when it comes to implementing new approaches. It feels like across North Central London that we're absolutely on the front foot.
GP practices are willing to give us permission to help them and to organise on their behalf sort of general practice at scale.
We are breaking boundaries in terms of integrated working.
And I think this is something that has long been needed insofar as that we need to work in a much more joined up way.
The advent of primary care networks, it's an exciting time. It's certainly going to be good for patients.
Everyone's across North Central London has been working on the Care Closer to Home programme for the last couple of years, and we've made real strides to deliver some of the projects that are key to the programme. In our sort of work across North Central London, we are looking at ways of bringing together all of the different providers across a geographical area to develop care and health integration networks.
Islington GP Federation was set up to ensure that patients in Islington get access to good, safe, value for money healthcare.
It's really difficult as a small practice in Islington to be heard and to be visible amongst all the other providers across the local system. It makes it easier by having that sort of central place where you can communicate your ideas.
I think the thing that's most powerful about the Federation is that over 4 years it's built a degree of trust across the borough.
Quality improvement has been it's been used as a tool to try and get groups of practices to work together.
We can sort of effectively target services, initiatives, efficiencies working at scale at patient level, network level, or indeed 80 to 90,000 patients with the localities.
Resilience has been a key focus of the Federation. Super admin is a great example of that. The aim was quite simply to remove unnecessary admin and paperwork from the doctors' surgeries. Yeah, results have been amazing. You know, benefits obviously are more time for the doctors.
And actually one of our colleagues in the borough has said that it's been the single biggest administrative impact on his practice in 10 years.
Frailty is an actual clinical diagnosis, and it's about having a lack of reserve to fight against a minor illness. So 9 GP surgeries in North Islington came together with the idea that we would proactively identifying patients. We've got numerous organisations all working together, integrated, to try and identify people early so that we can help them.
Having clinical pharmacists in general practice means having this new workforce with their new skills around medicines management, working alongside other clinicians in general practice. We are a team of 8 clinical pharmacists. Each pharmacist is assigned a network. We know medicines are the single biggest intervention in general practice, and the idea behind having a clinical pharmacist in general practice is to make sure that we get the most out of medicines that are being prescribed to our patients. We also kind of help with the workload of GPs by tackling any questions or queries, or even seeing patients that do not necessarily need to see a GP, and therefore saving those precious GP appointments for patients who need it the most.
So I'm working on the SMI project, which is an abbreviation for the serious mental illness. It's people who sit on a GP register who are coded with the serious mental illness. So that encompasses people with schizophrenia, bipolar, schizoaffective disorder, or any other broad brush psychotic disorder. A large part of what we would do is knock on doors, go out and do home visits and bring all the equipment that we've got. The other unique element, I guess, of the project is that we see people and we do everything as a one-stop shop. So I guess it's recognising that your health is a whole thing. It's not mental and it's not physical, and bringing it together in that as a one-off appointment.
When you see people working together and talking and communicating, then you absolutely feel that there has to be sort of benefits to everybody.
What we're seeing is that it's actually becoming real. It's happening in practice, it's happening on the ground, and that's very exciting.
The Federation takes away barriers. We've learnt really quickly and developed expertise in many things that we didn't used to be able to do.
I am myself very much enjoying the role, and I believe my team would agree.
I live and work in Islington. It's a vibrant borough. I'm really excited that the Federation offers an opportunity for our local clinicians to get involved with something which is bigger than an individual practice and allows you to work with many more partners within the community.
There really is an opportunity to make a significant difference to patients if we work collaboratively in a far more sort of joined up way.